Well, hello there, and welcome back to another episode of the Smart Start Recreational Therapy Insights by Smart CEUs Hub. I'm your host, Nathan Lemaster, and folks, we are on to episode number 45 today, and we'll be talking about approaches to disability etiquette and awareness. So whether you work in clinical, community, school settings, disability etiquette matters, okay? And let's talk about how to foster truly inclusive environments, not just through programming and adaptations, but also through language, behavior, and mindset. All right, so why does disability etiquette matter? Disability etiquette is not about being politically correct. It's about respect, empowerment, and promoting dignity. As RTs, we're often the ones modeling inclusive behavior for our clients, coworkers, volunteers, and even families. When we demonstrate respectful language and interactions, we help shape the culture and inclusion around us. Remember, inclusion isn't just about physical accessibility. It's also about social and emotional accessibility. All right, so now some general principles of disability etiquette. Here are some foundational tips that you can use and you can share. Always speak directly to the person, not to their caregiver or interpreter. Okay, I've talked to people that have used wheelchairs, for instance, and when they are in a social setting, sometimes they're thought of as somebody who's not mentally capable or socially capable. And so people talk to whoever's with them and they feel very insulted by that. So that is definitely a thing to consider. Don't assume someone needs help, okay? Ask before assisting. So we did this experiment at Sac State when I was in college where we spent a whole day in a wheelchair, and our goal was to see how people treated us, how accessible the college and university we were at actually was, and just kind of get the overall experience of somebody who has to use one every single day, so we can better understand where they're coming from. And so throughout that day, I would go, like for instance, to the bookstore, and the door to the bookstore I had to pull up next to, and then I had to pull back and get myself into. And there was kind people that would come up and say, "Hey, can I help you?" And they would open the door. Okay, so sometimes that's nice, right? Other times, when like this is another instance that happened that same day, there was this really steep ramp going up to the library, and even a little bit of an incline makes it really difficult for people in a wheelchair. But as I was going up and trying to balance books on my lap, this guy just comes up from behind and starts pushing me without asking. So I can see how that might be something that is, like, get out of my personal space. Like, do I even know you? It's kind of disrespectful. So don't assume someone needs help. Ask before assisting. All right, use person first language, okay, where it's appropriate. Use identity first as preferred by the individual. Okay, avoid language that implies pity, suffering, or tragedy. If everyone was telling you, "Oh, poor kid," or something sad all the time whenever they were around you, you kind of develop a complex, wouldn't you? Okay. Respect mobility aids and assistive devices as extensions of the person's body. Okay. Never lean on or move them without their permission. And make eye contact and be mindful of body language. Okay. Be patient with communication, especially when working with individuals with speech or cognitive challenges. Okay. And these guidelines might seem simple, but in the real world, they're often overlooked, unfortunately. And as RTs, we should be leaders of respectful communication. All right, common etiquette by disability type. So let's break down some common considerations based off of subcategories of disabilities. Okay, first category, cognitive and developmental disabilities. In this category, when dealing with somebody, typically you want to use clear, simple language and allow for processing time. Okay, don't just go from one sentence to the next and not allow for the words to sink in and to be processed. Okay, provide visual cues when possible. Okay, and especially don't talk down to uh, anyone just because you assume that they're not as intelligent as you. Um, Use age appropriate communication. So if they are an adult, talk to them like they are an adult. Um, so that's what you should really pay attention to in this category. Second, physical disabilities. Okay, speak at eye level. So if sometimes when you're standing up and you're looking over someone, it could feel like you're more threatening. And when you get down more on your knees and eye level, you feel like, okay, we're in this together, and that helps build that connection. Um, and never assume mobility impairment means cognitive impairment. Definitely don't just look at somebody in a wheelchair and assume that they're, cognitively have an issue. Ask before moving equipment or adjusting environments. Okay, so don't just touch their stuff, right? They have it that way for a reason. Okay, now hearing impairments. This category, really important that you maintain eye contact. Okay, so avoid covering your mouth when speaking. When you have eye contact with another person, right, they know you're talking to them. And then, especially when you're combining sign language sometimes with your mouth movements, having your hands up here is not going to help them to be able to understand you. Okay. Offer your elbow to guide, like if you're going on a walk, but don't grab someone without their consent. Ask them first, and then give verbal cues about surroundings when leading an activity. So make sure that they can hear what they can't see. Okay. And remember, everyone's preferences vary, so don't assume. Respect individual choices and ask what makes someone the most comfortable. All right, teaching etiquette through RT interventions now. So, as RTs, we can use leisure to promote disability awareness with others. Some ideas include leading disability simulation activities for community partners and volunteers, facilitating inclusive sports programs where able bodied individuals experience adaptive formats, using games or discussions to teach children about respectful communication, hosting awareness weeks or educational campaigns tied to therapeutic recreation themes. RTs can also serve as consultants to the families, training coworkers, volunteers, families on disability etiquette. All right, now we're going to go on to avoiding pitfalls and practicing awareness. So let's address a few common mistakes. So these are things people do that they're trying for a reaction sometimes. So the first one is called inspiration porn. Yes, I said inspiration porn. That's sharing somebody's disability story for emotional appeal or pity. So you're telling it to someone else so that you can make them feel bad or feel bad for that person. Okay, assuming disability defines a person's identity or life experience is definitely a no-no. And using outdated terms like wheelchair bound or handicapped or crazy, when you're talking about somebody who has a disability, that language is definitely not appropriate, and it it isn't serving anyone. So keep your language and perspective rooted in dignity and agency. If you make a mistake, don't panic. Apologize, learn, and do better next time. All right, now some wrap ups and takeaways from this week. So, to wrap it up, disability etiquette is foundational to creating inclusive therapeutic environments. In using respectful language and body language, ask before helping and defer to the individual's preferences. As RTs, we can model this etiquette and teach it through our programs. And awareness, empathy, and continued learning go a long way. And remember, inclusion starts with us. All right, guys, thank you so much for watching this episode. I hope you enjoyed it as we talked about disability etiquette. Folks, if you've been liking these videos, you can help us out by hitting that subscribe button under the video, that like button, and that notification bell to let YouTube's algorithm know that our content is out there. We're trying to spread it like wildfire to other recreational therapists and beyond, so more people know about our field and so that RTs can have content that's out there that they can learn from as well on YouTube. And guys, I've enjoyed so much making these videos. Have a happy Monday. Next week, just to give you a little teaser, we're going to be talking about how to measure and improve the outcomes of our programs through data collection. So we'll be talking about utilizing data to improve our programs. And this is perfect for RTs that are wanting to impact or secure funding. And you don't want to miss it, guys. Happy Monday. I hope you have a good rest of your week. And as always, recreational therapists, stay classy.